Hello, I'm Shona from Mindset in Motion, and today I want to talk to you about mindfulness and chronic pain and how they can work in conjunction with each other. Now, I've got a website, my own business is called Mindset in Motion, and I've struggled with chronic pain and also I've dealt with a lot of stress in my life as well. And this is why I've decided to become a mindfulness practitioner. My website address is www.mindset-in-motion.co.uk, and I have lots of tips and blogs on my site to help you with mindfulness, including chronic pain as well. You might find some information on my Mindfulness Monday page. I've also got information on my Wellness Wednesday page, and also Time to Make a Change Thursday, all of which you might find useful. So I'm going to start off with talking to you about how could mindfulness assist with chronic pain, because I can imagine that you're probably thinking, how can that help without just painkillers? So with practice, mindfulness teaches you to focus on being mindful of your own thoughts. Now, I started to practice mindfulness myself when I was diagnosed with fibromyalgia in 2013, following a bout of extreme stress at a previous job. Now, it took 3 years for me to get diagnosed by a rheumatologist. And for a long time, I was made to feel like I was making up my symptoms. But I knew, and those close to me knew, that my symptoms were very real because the pain and fatigue was just unbearable. I wouldn't be able to use my hands. They would go into like a claw-like shape. My feet would feel like I was walking on hot coals or being a bunch of stinging nettles. My neck and shoulders would seize up. I wouldn't be able to move. If I got out of bed in the morning, I would be walking like I was probably about double my own age. I'm 44, by the way, now. And if anyone even went anywhere near my hip area, then they were lucky not to even get a black eye. That's how bad it was. And I'm laughing now, but even sometimes now that is still the case. It was also the feeling of fatigue afterwards that was just awful. It would sometimes take me 10 minutes just to climb the stairs. You can see the stairs behind me here. And this is for someone, now myself, I'm usually really, really fit and can teach several spin classes in one day. So for me to have no energy to even walk up the stairs I find that really difficult to deal with. I tried many different types of medication, including regular painkillers, which did nothing. Codeine, which just blocked me up. I'm sure anyone who's relating to this will be nodding their heads right now. They also made me feel quite stoned. I tried another tablet called duloxetine and a high dosage of amitriptyline, which would also just make me want to sleep all day. I did tend to get used to them after a while, but then again, like any other drugs, once you get used to them, they tend to lose their side effects anyway. And although I knew there was no cure for fibromyalgia, I was determined that I wasn't going to let this condition beat me. So I started to look at alternative treatments. This was when I came across mindfulness. And there was a book I read. I'm just going to grab it. Sorry, I meant to have it near me. So I was introduced to this book, and I can't recommend this book enough. So this is a book by Mark Williams and Danny Penman, and it's called Mindfulness, A Practical Guide to Finding Peace in a Frantic World. This also came with a CD of guided meditations. Now, I recommend this for anybody who is struggling with stress in particular, and I'll come on to the chronic pain elements in a moment. Now, although the book and the CD did really help me, I found it difficult alone to teach myself mindfulness from just that. Now, some people can just go through that with a book and meditation CD themselves. But for me personally, I needed someone to actually help me in addition to that. So I embarked on an 8-week mindfulness course, which really helped me and my fibromyalgia. and my attacks improved significantly because I was controlling my stress, and that seemed to be the major trigger for my attacks. And when I was having my attacks, I had learned how to control them with the breathing exercises I learned, which I'll also teach you as we go along. So you may ask, well, what about controlling the pain? So it wasn't until 2 years ago, and on the 21st of February 2017, that I really needed to use my mindfulness techniques to really help me deal with chronic pain and put this to its true test. So on that day, I ended up having a life-changing accident. What was interesting about this as well is both Mark Williams and Danny Penman, the author of the book I just showed you, they've both been involved in very serious accidents themselves, which is why they got involved in mindfulness. Now, up until now, I'd only needed it for the fibromyalgia and the stress, which was bad enough. But now on top of that, I'd broken almost every bone in my face and fractured my skull, and I required major facial reconstructive surgery. Yes, the pain was intense. And in those first couple of weeks, it was unbearable because I had a bad reaction to the painkillers. So I was very sick and no pain relief was staying in my system. However, then I realized that Mark Williams and Danny Penman had a second book. Here it is, called Mindfulness for Health, Practical Guide to Relieving Pain, Reducing Stress, and Restoring Wellbeing. This book also comes with a CD of guided meditation. Now, the first book had helped me to a certain extent, and now with lots of time on my hands to recover, I had nothing to lose but give this a try, and the results were incredible. I was able to control my pain a bit like a volume control by simply focusing on certain parts of my body and meditating. Now, I'll be honest with you, this didn't happen overnight, but I was determined to practice because by now my fibromyalgia had hit me hard with a vengeance. Also, and I was absolutely desperate. I didn't know what to do. I was like, I was actually thinking, why me? Why is this happening to me? Again, and I kind of got myself into that victim state of thinking like a victim, and I didn't want to feel like that. Now, you may relate to this as well. Pain always seems worse at night. Do you agree? It does. Why is this? Is it the silence? Is it because the mind is silent? You want to do anything you can to make the pain go away. You start thinking to yourself, I can't cope with this anymore. Why me? I want this to all end. Should I take more painkillers, even if you've taken your max dose already? What will I do if this pain gets worse? What if it never goes away? I'm sure you've asked yourself these questions if you're in this situation, whatever your condition is, illness is, injury. Now, you're probably saying to yourself right now, what are the benefits of mindfulness for pain? Now, I use a combination of Mark Williams and Danny Penman's techniques, and also the lecturer who I learned my mindfulness practicing techniques with, a guy called Kane Ramsey. Now, Kane was somebody who had been to Afghanistan. He was in the army. He'd seen a lot of things going on. He'd suffered a lot of trauma himself. And I found that because his was very, very practical as well, and I got to meet him, I found it more of a personal experience. Now, this is what works for me. And basically, Mark and Danny use a series of simple practices that you can incorporate into your daily life. And this will significantly reduce your pain and your stress. Now, they are built on what's called mindfulness-based pain management. For short, that is MBPM. The core mindfulness meditation techniques have shown in many clinical trials to be at least as effective as drugs or counseling for relieving anxiety, stress, and depression. And when it comes to pain, clinical trials show that mindfulness can be as effective as the main prescription painkillers, and some studies even show that it's as powerful as morphine. So that says a lot. Even many hospitals now prescribe mindfulness meditation to help patients cope with the suffering arising from a wide range of conditions such as cancer, heart disease, diabetes, arthritis, back pain, migraine, fibromyalgia, celiac disease, lupus, multiple sclerosis, irritable bowel syndrome, chronic fatigue syndrome, and I'm sure there's many more to come as well, but there's a long list here. Okay, you can sort of see my point now. So how does mindfulness and pain work together? With mindfulness, you learn that pain comes in two forms. You have primary and secondary, and each has very different causes, and you do need to understand the two to control it. So primary pain, this tends to arise from illness, injury, or damage to the body or nervous system. And you could describe this as the raw information being sent by the body to the brain. And then secondary pain, that follows on close behind, but is often far more powerful and distressing, and it is very, very real. It can be seen as the mind's reaction to primary pain. And secondary pain is best described as suffering, but you can learn to control it. In practice, you can be in pain, but you need not suffer. And this is where mindfulness and meditation comes in. However, there's no need to be skeptical about meditation, because I know sometimes meditation, a lot of people automatically think you have to sit with your legs crossed in like a Buddha type position. No, that's not what we do with this type of meditation. Just to take away any myths or wrong beliefs, meditation is a form of mental training to help people cope with pain, stress, anxiety, illness, depression, and exhaustion. Meditation boosts mental and physical resilience. You will not adopt a fake positive attitude to life. It helps you to enjoy life and reach your goals. Meditation doesn't take a lot of time. And meditation is not difficult or complicated, but it does require practice, and you can do it anywhere. So you don't have to do it in a particular place. You can actually do it everywhere. So I'm just going to very quickly, just to finish off, take you through a simple breath-based meditation test, just to show you how simple this can actually be. And literally, you just need a few minutes. And I'm sure even in people's frantic lives, you can find a few minutes to do this. So I will also put a video on my website as well on how you can do this. If anyone wants to check it out, feel free. So if your condition allows it, the best way to do this is to sit erect but relaxed in a straight back chair with your feet flat on the floor. Now, if you can't sit, doesn't matter, then you can lie on a mat or on a blanket or on a bed. So just take that time just to do that if you want to do it right now. Then I want you to allow your arms and your hands to be as relaxed as possible. So just let all of that tension disappear. Okay, just really relax. Anything which feels tense, just relax it. Focus on everything in your body and just relax it. Then gently close your eyes and focus your awareness on the breath as it flows into and out of your body. Feel the sensations the air makes as it flows in through your mouth or your nose, down your throat and into your lungs. Feel the expansion and subsiding of your chest and belly as you breathe. Focus your awareness on where the sensations are the strongest. Stay in contact with each in-breath and each out-breath, and observe it without trying to alter it in any way or expecting anything special to happen. Just breathe in and out. And when your mind starts to wander, gently bring it back to that breath, because your mind will wander, and that is normal. Don't beat yourself up about that. Just when it happens, bring your mind back into that in-breath and out-breath. You may find that your mind will eventually become calm, or it may not. If it does become calm, then this may only be short-lived. Your mind may become filled with thoughts of all powerful emotions such as fear, anger, stress, or love. These may also be fleeting. Whatever happens, simply observe as best you can without reacting to your experience or trying to change anything. Gently return your awareness back to the sensations of the breath again and again. Do this for as long as you feel comfortable and relaxed. Then, after a few minutes, or longer if you prefer, gently open your eyes and take in your surroundings. Now, this is an exercise you can practice as many times as you like. You can either go over this part of my video or have a look at my instructions on the website. But the more you practice these mindfulness meditation exercises, the more they will work for you. And how long did that take? Okay, thank you for listening. And if you do want to subscribe, then I am Shona Hirons at Mindset in Motion. Bye-bye.